Hi, my name is Dr. Nikki Hoffman. I'm an assistant professor in athletic training, as well as the graduate sequence coordinator for our post-professional athletic training sequence here at Illinois State University. What I'm going to do for this presentation is identify just a basic overview of our program, including signature features, specific courses within our curriculum. I'll touch on a little bit of research interest with respect to our athletic training faculty, as well as admission requirements. So there are a couple signature features I want to highlight. All the grad students in athletic training hold a graduate assistant position through various locations, including ISU, local area high schools, clinics, and smaller local colleges and universities. I'll touch on this a little bit more in just a minute. Our program combines didactic education with real-world opportunities for clinical practice and advanced assessment skills, and they're integrated throughout our courses. Students gain advanced manual therapy skills, including muscle energy techniques and Graston technique certification. Our research core culminates in an individualized research experience that aligns with personal and professional interests. Our research projects have led to publications in field-related journals, and culminating research projects have been presented at national conferences within the professional field. You have opportunities for preceptor experience through our professional CATIE accredited program. Some pride points that I want to highlight as well include that our students experience individualized attention from our dedicated faculty, all while having the reputation of being ranked by US News and World Report as one of the top 100 public institutions. 100% of our program graduates secure employment within 4 years of graduation, and several graduates go on to earn the highest degree in sports medicine, or they complete terminal degrees. The Athletic Training Post-Professional Graduate Program here at ISU advances knowledge beyond the entry-level athletic trainer. The program focuses on applying various manual therapy techniques and biomechanical principles to prevent, evaluate, and treat musculoskeletal pathologies. Students learn critical inquiry and reasoning for certified athletic trainers. Using a variety of teaching methods, philosophies, and experiences, students gain practical knowledge and research skills to become scholarly clinicians. Courses are delivered across fall and spring semesters. Your first semester, you'll take about 12 credits, and then the subsequent semesters will be 9 credits per semester. So you'll be required to take about 21 credits within our athletic training core. The research core culminates in an individualized research experience that aligns with personal and professional interests, and students can select either a thesis or non-thesis track for degree completion. So what will you study? Students will perform manual therapy techniques such as muscle energy techniques, joint mobilizations, Graston technique, and instrument-assisted soft tissue mobilizations. You will gain research skills and perform research writing in a variety of formats, including case studies, literature reviews, systematic reviews, manuscripts in general. You will explore and gain a deeper understanding of biomechanical principles in injury and recovery. And you'll be able to relate ideas about evidence-based research to help implement patient-oriented care and assess the outcomes to be shared with healthcare professional peers. So here's a sample of our post-professional AT courses. As I mentioned earlier, you'll have research core and core classes. So you'll have introduction to research methods, and you'll have to take a statistics and applied science and technology course. As far as our athletic training core courses, you'll have a wide variety, including biomechanics of exercise and physical activity, evidence-based practice in sports medicine, advanced assessment and treatment of musculoskeletal injuries, advanced seminar injury biomechanics, as well as 2 manual therapy courses. So as far as thesis or non-thesis track, basically the thesis track shows prospective schools and employers that you possess the skills needed to be an independent researcher and is typically selected for students hoping to pursue a terminal degree. The non-thesis track is less rigorous, and it allows students to take on an additional class to advance their knowledge to fill the time they would have spent with a thesis. Both tracks require students to formulate a research question, create sound methodology, and present and discuss results. But if you were wondering which route should you go, that would be ultimately what are your future career goals, and you can discuss this once you are assigned to an advisor in our program. So you don't have to come into our program knowing which route that you're going. As far as elective courses, you are allowed to take courses across the university or within kinesiology and recreation, just as long as it's graduate credit. If you want, there may be teaching assistant opportunities depending on how it fits with your schedule, especially if you're interested in teaching down the road. We have 3 graduate faculty members who explore a wide variety of research interests. I particularly have a focus on sleep and concussion recovery. Dr. Noelle Selko's areas of research include cryotherapy, blood flow, manual therapy, and diagnostic ultrasound. And Dr. Justin Stonik's research focuses on assessment and treatment of lower extremity injuries. Admission to the program is competitive, and admission decisions are based on a variety of factors, including undergraduate GPA, letters of recommendation, and future career goals. To be considered for admission to our program, applicants must have a cumulative GPA of 3.0 on a 4.0 scale for the last 60 credit hours of your undergraduate coursework or any previous work in a master's program. We ask that you submit 3 letters of recommendation, a resume, your GRE scores, and you can indicate when you go to send the scores to us, institutional code 1319 for ISU, and include a 1-page statement of your career goals. So that would be specific areas of why are you seeking ISU for graduate school, how our program will prepare you for your future goals, as well as which graduate assistant position potentially interests you. Applications for the post-professional athletic training program are due on December 15th. Upon successful review of your application materials, you may be contacted for an interview with the AT faculty so we can learn more about your goals and also overall get to know you better. To be eligible for an assistantship, a student must generally be admitted unconditionally as a degree-seeking student into a graduate academic program. They must be in good standing, as well as be enrolled full-time. So in order to classify as full-time, it's at least 9 credit hours during the fall or spring semesters. Graduate assistants will receive monthly wages paid in the form of either a stipend or an hourly wage. You'll have a waiver of 100% tuition during a semester of appointment and a waiver for up to 12 credit hours for the summer term if that's something that you choose to do. Most of our students typically take courses during the fall and spring semesters. Depending on available funding, our department may award additional waivers on a competitive basis to students who show extraordinary promise for success. So I have a list of potential clinical sites that may be available. Our positions vary year to year depending on the turnover of the previous class. So, excuse me. What I mentioned with respect to Illinois State University, you may be assigned to athletics, but this is actually a competitive process that's separate from our graduate assistantships through like high schools and other areas. If you are interested in potentially working with ISU athletics, you have to submit an application through, I believe the posting is at the NATA website, so you can look for that there specifically, and then they do their own selection. Plus, you have to get admitted to our graduate program. Other clinical sites that we do offer, that would be local area high schools. We've got Illinois Wesleyan University, which is a Division III school right down the road from us. Lincoln College and Lincoln Christian University are NAIA institutions. We also offer clinic opportunities. So we've got the SMART Clinic, and that's through Illinois State. It's through our athletic training laboratory space. We have a chiropractic clinic that we have an athletic training student there. And we also have a Gamma Phi Circus, which is through Illinois State University. If you have any further questions, please reach out to me. I would be happy to further discuss your interest in our post-professional athletic training program. Thank you so much.